I had a chance to speak to Mark's mom, Corinne. When she called me on the phone, she had just come from the doctor's office and was informed that Mark needed to have a tonsillectomy and an adenoidectomy. So she was a little nervous. So we went through a lot of what was going to happen for Mark so that she could then tell him about it.
Hello, how are you? Good, how are you? I'm Karina Williams. This is my son Mark. We're checking in for surgery today. Yes, we are expecting you.
It starts with the receptionist who puts a band on the child, and so that way we know who that person is, and we continuously check that band throughout the day to make sure that we have the proper patient and the proper procedure. Hi, I'm Tony. I think I spoke with you on the phone.
You
How
did.
are
Hi,
you?
nice to see your face, Tony.
And you must be Mark.
Yes.
Well, my job today, I'm a child life specialist, and I'm here to tell Mom and you a little bit more about what's going to happen because we don't want any surprises. It's fun to have a birthday party surprise, but not a doctor surprise. I was able to show Mark the mask that they would be able to use with him for his anesthesia and how it would go over his nose and mouth, and he actually got to touch it and feel that it was very soft, and that too made him feel a lot more comfortable.
Hello there. How are you?
The patient liaison's role is to check in and see how the family is doing, and that person often goes back and forth during the procedure. So if there are updates that need to be given to the parent, the doctor stays where they are, and the liaison will come out and let the family know how the surgery is going.
Please do not hesitate to contact me.
The other thing they would do is things that he's done at this doctor's office before: get on the scale to see how much he weighed, have his blood pressure checked, and also his temperature.
You are 3 feet 11 inches tall. You're taller than the Eskimo.
Wow.
That's pretty
But
good.
I'm taller than the...
Oh, you'll get there. Give me a high five.
Throughout the day, then they will see a variety of physicians. The anesthesiologist will talk with them.
So just to review a couple of things, he's had nothing to eat this morning.
No.
Last time was last night. Okay, that's just to make sure the stomach is as empty as possible, so that when he does go to sleep, nothing can come up the wrong way and possibly irritate or hurt his lungs.
Okay.
The way that he'll fall asleep is by breathing through a mask. We have a couple of different masks that have a candy flavor that's more attractive to kids.
One of the questions that Mark's mom was asking is whether she'd be able to go into the operating room with him, and so we always direct parents back to the anesthesiologist.
We're usually okay with parents coming in because it's helpful for children to have them nearby as they're falling asleep.
Okay, I'd be able to sing him a song or something. Okay.
Exactly. So he would be able to fall asleep with you near him. Should that not be sufficient, we can also give medicine by mouth. That can kind of make him feel better about being in the operating room.
Okay.
And then the doctor who will be doing the surgery will stop by and have the parent sign the consent form.
Okay, so I just wanted to get some of the paperwork done
Okay.
in preparation for the procedure. So I have the consent form here. This says that we talked about why we're doing the procedure and the risks and the benefits. I wrote here that the procedure today is tonsillectomy and adenoidectomy.
Okay.
Is that right?
Okay.
Okay, great. So I'm just going to get your sign here, print your name here, and just say here that you're the mother, and then date right over there.
The other thing that he would need to do is get changed into special hospital pajamas, and for children his age at 5, that's something that feels a little funny. They would rather keep their own clothes. But we talked about it, and she was going to at least let him practice at home what that might feel like. We're going to come on in here. Oh, everybody, this is Mark and his mom.
Good.
My name is Alice and I'm one of your nurses in the OR. How about, so how are you doing today?
Good.
Okay, you want to come in here?
I'm just going to move this pillow onto your head, Mark, okay?
There's that
Put
warm
a
blanket.
warm blanket and a safety belt, okay? Everybody gets a safety belt.
Great.
There you go.
So the last thing we have is a muscle measure, otherwise known as a blood pressure cuff.
Never see how strong you are.
We're just gonna put it on your arm, okay? This is the bubble gum mask. Let's let Mom smell it.
It smells good.
Cherry mask.
Yeah.
cherry
Oh, you
bubble
think
gum.
cherry? Oh, okay. Does that smell good?
Yes.
Okay.
Once he was in the operating room, he got to see some big lights, and his mom stayed right next to him, and he breathed through the mask just as we had practiced, and he fell off to sleep. And then the next thing, he was in the recovery room after the surgery. The nurse was there to make sure that he was monitored. His mom was right there.
Hi Mark, how are you feeling?
Good.
Good. My name is Marlo, I'll be the nurse taking care of you. Mom, we'll go over all your instructions for the day, what he's going to eat over the next 24 hours, pain medications, and how to take care of him at home.
Okay.
And then when you're comfortable with all the instructions and he's comfortable not having any pain, we'll get you on your way home.
Okay.
Okay?
When can I give him real food?
We usually have the parents wait until you get home because some kids can get nauseous on the car ride home.
Okay.
So we keep it light here. Apple
Okay.
juice, water, ice pops. And then when you get home, he can have a light meal, nothing heavy or greasy for the first 24 hours because some kids do get nauseous from the anesthesia.
Oftentimes children, when they're in an unfamiliar environment, just need to be reassured from their parents. So one of the things she could do is just keep as calm as possible. So a lot of the conversation she and I had were things that would help her help him.
You're doing a very good job, okay? You keep up the good work and you'll do just fine.
Okay.
No matter what a child's age, they always have questions and they're wondering about what's going to happen when they are told that they need to have surgery, as the parents are wondering. So our job is to really be able to help the parents be able to turn around and reassure their child. And we always tell them that no question is silly. The more they know, the more they're going to feel comfortable.